Welcome back to the Listening Doctor. I'm Dr. Sowmya Josyula. Today I want to explore a skill that many doctors underestimate, but every patient feels deeply: the power of silence. Silence is not empty, it's not passive, it's not doing nothing. Silence is space, silence is safety, silence is dignity, especially for the older patients. Silence can bridge between confusion and truth. Let me share a story of an 85-year-old man who taught me just how loud silence can be. He was 85 years old, a quiet man whose eyes seemed tired, suspicious, and lost all at once. He would stare into distance as if searching for words that kept slipping away. He came in with pains all over, and as he spoke, his sentences felt scattered, fragmented, and confused. He had uncontrolled congestive heart failure, leading to recurrent hospital admissions, maybe around for the past 6 months. Every discharge summary said the same thing: medication non compliance and high risk for readmission. But what no one had ever asked was why? He didn't have a stable primary care physician. He had seen many doctors in different clinics, each treating a different symptom, adjusting medications, or running the test. But no one dug deeper. No one slowed down. No one made the eye contact long enough to see the man behind the chart. He told me something that broke my heart. Doctor, sometimes I feel like I'm everyone's problem. He felt ignored, dismissed, rushed, and invisible. When he walked into my clinic for the first time, he sat down slowly, like he was unsure if he even belonged there. He started to describe his pains and then stopped. His eyes wandered. He looked embarrassed that he couldn't remember clearly. Any other doctor might have jumped in. Do you mean chest pain? Is it sharp? Dull? Is this new? But instead, I did something simple, something radical in today's rushed medical world. I stayed silent. I leaned in. I softened my expression. I maintained gentle eye contact. And I let the silence hold him. That silence did not pressure him. It protected him. After a long moment, maybe 10, maybe 15 seconds, he looked up and whispered, Doctor, I get confused. I don't take my medicines right. Another pause, another silence. This time, I didn't fill it. Then came the truth. I live with my girlfriend. Sometimes she gets angry. She tells me to leave the house. I get scared. In that moment, everything made sense. His non-compliance wasn't forgetfulness, it wasn't irresponsibility, it wasn't stubbornness, it was fear, instability, a lack of safety at home and in healthcare. Silence didn't just give him time to speak, it gave him permission to reveal the truth. In medicine, we often talk about diagnosis: CHF, hypertension, arrhythmias, volume overload. But there is another diagnosis, one we miss often because we are talking too much, moving too fast, or filling every pause. This man's real diagnosis was unsafe living environment, lack of coordinated care, and emotional neglect. Medication non-compliance, recurrent CHF admissions. He didn't need more medications. He needed placement. He needed safety. He needed someone to take the time to see the full picture. And silence, the quiet, gentle, patient kind, revealed all of that. Once we understood the truth, everything changed. We arranged for coordinated care, medication management, pillboxes and schedules, social services, and ultimately safe placement. With stability came clarity, with clarity came compliance, and with compliance came fewer hospitalizations. He wasn't difficult, he wasn't non-compliant, he was just unheard. And when he finally had space to speak, he gave us everything we needed to help him. Silence is not a gap in conversation, it's a clinical tool. Here's what silence does. Silence protects dignity. Older adults often feel ashamed when they can't recall details quickly. When you wait, you tell them, "You're not a burden, I'm here with you." Then silence reveals the truth. When we stop talking, patients gather their courage to say what they were scared to say. The third, silence helps us diagnose life, not just disease. If I had rushed him, I would have missed the most important detail of all, his unsafe home situation. Silence builds trust faster than words ever can. Patients don't always need answers first, they need space first. Before I end today's episode, I want to speak directly to young physicians. Silence does not make you a therapist. It makes you a healer. Giving an elderly patient 10 seconds to gather their thoughts is not therapy. It is medicine with dignity. Allowing someone to speak without interruption is not psychological counseling. It is clinical respect. Letting a vulnerable patient cry, pause, or search for the right words does not drain your boundaries. It strengthens your connection. Silence is part of physical exam. Silence is part of history. Silence is part of healing. In that quiet space, patients tell you the truth, and truth is the first step to treatment. Thank you for listening to The Listening Doctor. In our next episode, we'll explore the question behind the question, how to hear what patients are really asking. Until then, slow down, lean in, and let silence speak.